For the muscles of the palm, the first muscle we are going to be looking at that is most superficial is palmaris brevis. Remember, palmaris longus is at the upper aspect of the forearm. So here is the brevis, palmaris brevis. It's overlaying itself over the little finger. Now, the hand can be grouped into two. The muscle groups around the thumb or inferior to the thumb is called the thenar muscle, TH, a thenar muscle. The muscle group that is inferior to the digiti minimi is called hypothenar muscle, meaning that it is the small size of the thenar muscle. So that's hypothenar muscle. Now, for the thenar muscle group, there is a mnemonics for learning it. There are 3 muscles there, and for the hypothenar, there are also 3 muscles. Now, these 3 muscles are acronymed as FAO. Okay, so the first muscle we will locate and study is abductor pollicis brevis. So we have seen the abductor pollicis longus. Now here is the brevis, abductor pollicis brevis. So you see that it is located at the base of the proximal phalanx of the pollicis and inserted into the carpal bones on the lateral aspect. So this is abductor, that is to abduct. This is abduction. Pollicis, that is the thumb. Brevis, that's the short belly muscle, that is A. Now the next muscle we'll be able to locate in the thenar muscle is flexor pollicis brevis. So this movement is to flex the pollicis, flexion. So it's located under the abductor pollicis brevis. You see that it was after hidden the abductor pollicis brevis, that was when we were able to appreciate and see the flexor pollicis brevis. All right, so this flexor pollicis brevis originates from the carpal bone straight to the medial aspect of the proximal phalanx of the pollicis. So flexor pollicis brevis, to flex the pollicis, and brevis, short belly. The last muscle, which is the O, is opponent pollicis. So we have identified the flexor muscle. And then the third muscle here is O, and that is opponent pollicis. Opponent pollicis. And you see that this muscle is wrapped around the metacarpal bone of the thumb. Okay, opponent means just to oppose. We know that the primates have 5 opposing digits, unlike the cats or other mammals whose digits are not opposing. Okay, so but these are opposing digits. The thumb can be completely separated from the 4 fingers. And with that, we have dealt with the thenar muscle. So we move to the hypothenar muscle. That is the muscle inferior to the digiti minimi. And these muscle groups are also following the same mnemonics, FAO. We start with the A because the abductor is located directly above the flexor. So wherever you find the pollicis, you will replace it with digiti minimi. So they are still the same muscles, but just a different name for the digit name. This is pollicis and this is digiti minimi, and here is the pollicis. All right, so this is the abductor digiti minimi. If the fingers are like this, or digits, so if you want to abduct the little finger, so it is through this movement, abductor digiti minimi. Then below it will be flexor digiti minimi. So flexor is always under abductor. So this is the flexor digiti minimi brevis. So meaning that it flexes the digiti minimi. It flexes the little finger. So look at it here around the lateral aspect of the hand. So that is the flexor digiti minimi brevis, to flex the little digit. And then brevis, meaning that it's a short belly. After the flexor, there's a muscle that is wrapped around the metacarpal bone, okay, of the digiti minimi, and that is opponent digiti minimi, just like the pollicis, which is opponent pollicis. So here is opponent digiti minimi, and this is it, opponent digiti minimi. Now we move to the deeper muscles of the hand, or intrinsic muscles. So we started with the extrinsic muscle, which is the thenar and the hypothenar muscle, FAO. So let's go deeper into the intrinsic muscle. So for the intrinsic muscle, we have the central compartment of the hand, and this central compartment forms the floor of the palm. And these muscles are called Interossei. So these muscles are Interossei muscle, and there are 2 of them. So these muscles are arranged based on the function of the hand. Okay, so if the hand is abducting against a resistance, you will see that the dorsal aspect of your palm is tensing up. Okay, that means the muscles are located right here. So this muscle functions as abduction. Okay, if you want to know it, dorsal aspect abduct, but for the palmar aspect, they adduct. If you want to adduct these fingers, and then I put this hand against this resistance, you see that the pressure is on the palmar aspect. So the palmar aspect adducts while the dorsal aspect abducts. So abduction is done by dorsal aspect and adduction is done by the palmar aspect. The interosseous muscle in the palmar aspect is going to adduct. Okay, palmar aspect adducts. Okay, but the interosseous muscle in the dorsal aspect will abduct. The mnemonics for this is pad and dab. Palmar adduct, pad, dorsal abduct, dab.